I will be talking about the Northeastern Illinois University online Gerontology Senior Advocate Certificate. This is a certificate that would be very beneficial to many different individuals from backgrounds of psychology, social work, sociology, public health, counseling, education in general, and a lot of different fields that are looking at healthcare and healthcare related services. So we will examine the details of the online Gerontology Senior Advocate Certificate and how it is a good fit for you in terms of what you want to do to prepare for a growing aging population. As we are aware, there will be an increase in the number of older adults in the coming decades, certainly through projections now through the U.S. Census Bureau through 2060. Globally, there will be a growing number of older adults age 65 and older. And this isn't just an aging issue. We have to think of all the successive generations that are getting older, entering middle age, older adulthood, and later life. So kind of think of this as being more than one generation we're speaking of when we think about being a senior advocate. So the certificate is a post-baccalaureate certificate. We do have undergraduates that take it, that petition in their senior year, but most of our students are professionals in different fields of healthcare, senior services, applied fields such as counseling, education, among other things. And it's a 21 credit hour online certificate, which is convenient for professionals who need to balance schoolwork and many different other roles in life. And what it is designed to do is to help professionals who have certainly other degrees such as social work, psychology, public health, many different fields that might be looking for more training related to working with aging clientele and their families or caregivers or both, who just need that knowledge background. In terms of details of the online, again, post-baccalaureate certificate, the first area of coursework we would talk about is the core classes. Of the 21 credit hours, this is 15 credit hours. And our courses are offered fall, spring, and summer. We do prefer a fall cohort if possible. So beginning in the fall, we have our introductory Psych 401, Gerontology and Overview. Also in the fall sequence every other year, we have our Physiology of Aging, or Psych 403. We do a practicum because we feel as a certificate it's very important for students to have field-related experience in working with older adults and aging-related organizations. But you can waive it, and that would be a process of just suggesting through documented letter on letterhead information related to your previous background in working with older adults, and then we can just simply fill that with an elective. We have also, importantly, a public policy and aging class, our Psych 418, and also our ethics related values decision making in the elderly, Psych 426, which is always going to be an alternating spring sequence of courses. In addition to having these core classes, these 15 credit hours, the remaining 21 of the credit hours is 6 related elective courseworks, and we do suggest 2 different types of tracks, but you can always mix and match courses that you would prefer. So the first track within the certificate is referred to as the individualized or community outreach courses. You have a choice of 2 elective courses, 3 credits each. We have Psych 406, Aging in the Family, which goes over many different dynamics of biological and chosen families and aging-related issues within the family system. We have 2 more clinical courses, Psych 412, Psychopathology and Aging, and Psych 14, Psychotherapy of the Elderly, which are also online courses, dealing with a lot of different both normative and non-normative issues of adjustment to aging and associated family and caregiving role-related dynamics. And lastly, within this track, the Psych 434 Aging Services Network is more of a idea towards community outreach and services, and how design and implementation can be very important towards best supporting aging adults over time, for example, with aging in place issues. With track number 2, elective courses, same idea of 6 credit hours to choose from, or 2 elective courses. We have kind of a different, more broadened career path of public policy and administration. So if you recall, the first one was more individualized and community focused. This one is more at the level if the student is interested in learning more about public policy and administration. So for example, learning the issues of community and statewide laws and associated implementation of legislation. So under this, we have Psych 428, Aging and Cultural Diversity in the United States. Very important in terms of understanding how diversity is very much of a part of how services and elder advocacy should be formulated. Psych 432, Meanings of Old Age, is kind of a topic varies course. We look at a lot of different topics under the meaning of what it means to be an older adult. It could be one semester LGBTQ issues. It might be family related. It might be related to mental health. There's a lot of different interesting topic varies courses. Another one has been older worker issues recently. And last but not least is our topic varies course, Psych 455. And again, it's kind of more broader than even Psych 432. Different topics related to what might be interesting. One course that was taught a few years ago was an examination of aging portrayals in film. The term elder advocate, which is the focus of this certificate, is increasingly a part of healthcare and other service-related occupations. There are many organizations that emphasize elder advocacy and advocacy training through ARP, Alzheimer's Association, among others. And that's why this certificate, this post-baccalaureate certificate, specifically was designed in terms of to meet the needs of both individuals in family systems and patients who would be interested in self-education, also more professional organizations in terms of client care advocacy, and senior service specialists in terms of educational institutions. So there's those occupations that would benefit from this training. In addition to the aforementioned positions that would benefit from this training, related occupations are advocate for a hospital healthcare system, especially, for example, transition planning from formal care to informal care. A care coordinator, who's more of a person that works with families in the home. A geriatric care manager, who again could be an informal or formal system or community-based outreach consultant. Aging social services case manager has a lot of different roles. One is guardianship, and that certainly could be, among other things, an official role within a department on aging within a community. And if you would like to look at more different occupations related to the certificate training, feel free to check out www.geron.org or Gerontological Society of America, who has a lot of different information related to career paths within the field of gerontology, the study of aging. So, in addition to the different occupations we can apply the certificate training to, I think it's beneficial to talk about what you learn in terms of skills, professional skills related to the certificate training. Again, this is kind of, among other things, how we assess learning outcomes for the certificate. So, among other things, communication skills, both written and oral, are emphasized in a lot of different ways throughout the certificate training. Related to this is knowledge of diversity issues related to that type of communication, critical. Critical thinking skills, the ability to do research, very important, for example, in grant writing occupations. Observational skills, again, extremely important when working with families and older adults. Analytical skills, in many different ways related to environmental scan, working with older adults in terms of problem solving. There's so many different ways that we analyze situations working with older adults and their families. Advocacy, critical in terms of working through different problem solving aspects to community outreach with older adults and their families. Knowledge of community resources is definitely a comment that we get a lot from our students, that they didn't realize all the different resources available. Knowledge of social structures and change, so that kind of goes more towards that public policy and administrative aspects to our training processes. Understanding of corporate and government organizational structures such as public policy, critical. The ability to understand and improve human relationships, of course, very much an aspect of this human interaction, working with families and older adults and caregivers. Planning and managing skills, very critical in terms of casework and, again, program planning. Problem solving skills, again, goes back to that idea of analytic skills. Conflict resolution, very critical, working with different major stakeholders in terms of older adult cases. Writing skills, certainly, and data analysis skills. How do you look at both qualitative and quantitative data to then help older adults in the communities on an individualized basis? So, if you're interested in taking one course or more, please reach out to the Gerontology Program Coordinator, Dr. Lisa Hollis-Sawyer, at email l-hollissawyer@neiu.edu for a virtual meeting, or after the pandemic, a face-to-face meeting. But feel free to reach out, and I'm more than happy to talk with you about how this very important certificate training can meet your own very unique career needs, and how it really does anticipate the growing aging population for decades to come.